The search for effective treatments for addiction has taken humanity down many paths, from medications to behavioral therapies to spiritual practices. In recent years, a growing number of people have turned their attention to an unlikely source of healing: ayahuasca, a traditional Amazonian brew used ceremonially by indigenous cultures for centuries. Its use has expanded far beyond the rainforest, as desperate individuals in the grip of addiction seek answers when conventional treatments fail. Ayahuasca, made from the Banisteriopsis caapi vine and the Psychotria viridis leaf, contains DMT, a powerful psychedelic substance that interacts with serotonin receptors in the brain, inducing altered states of consciousness. And while the idea of drinking a mind-altering brew in the jungle might seem fringe or extreme, a growing body of early research and personal testimony suggests it may offer something many addiction treatments lack: a radical confrontation with emotional pain and trauma. That possibility should not be taken lightly. Addiction is not a simple matter of chemical dependency. It is often rooted in deep emotional wounds, unresolved trauma, and internal disconnection. Ayahuasca's ability to surface long-buried emotions, relive forgotten memories, and facilitate profound introspection makes it unique among potential therapies. Users commonly report feeling emotionally opened, more connected to others, and more aware of the roots of their self-destructive behavior. In this sense, ayahuasca doesn't simply suppress symptoms. It challenges the core emotional dynamics that drive substance use in the first place. And for some people, that challenge can be profoundly healing. Preliminary findings reinforce this potential. Studies in Canada and Brazil suggest reductions in the use of alcohol and tobacco following ayahuasca ceremonies, and others show improvements in mental health conditions that often underpin addiction, such as PTSD and depression. A 2019 study found participants reported decreased cravings and improved psychological well-being after taking part in ayahuasca experiences. These are not just anecdotal accounts. They point to the real possibility that, under the right conditions, ayahuasca could serve as a therapeutic agent for deep emotional and psychological repair. But as with any treatment that alters the mind so profoundly, there are serious warnings to consider. Ayahuasca is not a gentle or predictable medicine. The emotional intensity it provokes can be overwhelming, even terrifying. Many participants vomit, shake, or cry during ceremonies. While these reactions are considered part of the purging process in traditional practice, they are not trivial. They signal how deeply the brew can penetrate the psyche. For individuals with unresolved trauma or underlying mental health disorders, this level of emotional exposure can be destabilizing. Without proper preparation and integration support, an ayahuasca experience can stir up psychological material that is more damaging than healing. Furthermore, the physical risks are not negligible. Ayahuasca can cause significant changes in heart rate and blood pressure. It can also interact dangerously with medications, especially antidepressants and mood stabilizers. Mixing ayahuasca with SSRIs or MAOIs, for example, can lead to serotonin syndrome, a potentially fatal condition. This means that anyone considering ayahuasca must undergo thorough medical screening and should never attempt it casually or in unsupervised settings. The legal and ethical dimensions are also complex. Ayahuasca is classified as an illegal substance in many countries, including the United States, although certain religious groups are granted exemptions. Outside of South America, the retreat industry surrounding ayahuasca is loosely regulated, and not all facilitators are trained in trauma-sensitive care or medical safety. This leaves vulnerable individuals at risk of exploitation or harm. Traveling to a foreign country for a psychedelic experience without fully understanding the legal, cultural, or medical implications carries real dangers. Despite these serious concerns, it would be a mistake to dismiss ayahuasca outright. In a world where addiction is escalating and many existing treatments are falling short, the potential of ayahuasca as a therapeutic ally deserves careful, rigorous study. What sets it apart is not just its chemical composition, but the profound experiences it catalyzes. People report leaving ceremonies with a renewed sense of purpose, a stronger connection to their bodies and emotions, and a deeper understanding of their own behavior. For someone caught in the cycles of shame and numbness that characterize addiction, this shift in consciousness can mark the beginning of true healing. Still, hope must be tempered with humility. Ayahuasca is not a magic cure. It does not guarantee recovery, and it cannot replace the structured, evidence-based approaches that have been developed over decades. Cognitive behavioral therapy, support networks, and medical interventions remain critical parts of recovery for most people. At best, ayahuasca should be seen as a complementary therapy, one that may enhance traditional treatment, not substitute for it. Ultimately, ayahuasca reminds us that healing from addiction is not just a medical process. It is also spiritual, emotional, and existential. To truly recover, people often need to face themselves in ways they've long avoided. If approached with caution, respect, and the right support, ayahuasca may provide the context for that confrontation. But it is not a journey to be taken lightly. As the research unfolds and more is learned about its safety and efficacy, society must be prepared to consider both its promise and its perils.